So that's why eating cholesterol is not a major league player on however much cholesterol you're going to have in the tissues or in the blood of your body. But it's always more complicated, isn't it? So the next thing I'm going to talk about is, all right, how does that intestine decide? Let's let some of this free cholesterol in. Well, it has to, it doesn't diffuse through the intestinal membrane. There are molecules that can diffuse right in, but cholesterol, lipids in general cannot. We have specific receptors that bind to, recognize the lipids, and pull them through the enterocyte cell membrane and up. Before you know, it's inside the cell, the enterocyte. So we have one receptor that has the ability to recognize quote unquote sterols. That means anything that has the sterile structure, it would recognize, but it's constructed so it has an incredible affinity to recognize cholesterol. It has very little affinity to recognize phytosterols that you may have eaten in your veggies. It might recognize a few and pull them in, but very few if you have the perfect receptor. And let's give that receptor a name. It's a mouthful. It's the niemann-pick C1 like 1, niemann-pick C1 like 1 protein. So if I express that receptor, it's going to recognize mostly cholesterol, a few phytosterol molecules, and it's going to grab them and pull them inside the enterocyte cell. That's step one of absorption, going from the gut lumen into the gut cell, the small intestinal cell. All the lipid absorption is long before this stuff ever gets down to the colon. This is all the early part of the small intestine where most lipid absorption occurs. But, the small intestine is 20, 30 feet long. So it's got a lot of surface area to do that. But it's in the beginning third or half where most cholesterol gets in. All right. And maybe some phytosterols. A little bit of a side, because is there anything that regulates how much niemann-pick C1 like 1 an intestinal cell may produce? Number one is, your genes. There's a very specific gene that if you have will produce the proper number of niemann-pick C1 like proteins. But what if something went wrong, or maybe something went right? For some reason, you inherited the genes where you don't make very many niemann-pick C1 like proteins. That's called a loss of function. Good news, if you don't make very many niemann-pick C1 like proteins, you are what is called a hypo underabsorber of cholesterol. Wow. So you're actually denying the body a source of cholesterol. Here's even the better news. Throughout life, those people's cholesterol as measured in the blood might be 15 to 25% lower than people who have proper niemann-pick function. But you would think that little change in serum cholesterol doesn't matter. Over a lifetime, they have almost no heart disease whatsoever. So blocking absorption of cholesterol genetically is a gift from God, because you will have a much lower incidence of ever having atherosclerosis in your body. All right. But there's going to be another part of this receptor that we'll get to. So, but anyway, hope you are born with loss of function of the niemann-pick C1 like protein. So if we did cholesterol absorption studies in most humans, let's say in the middle is 50%. That means you will absorb 50% of the free cholesterol molecules that make it into your gut lumen. That's on average what a normal human will absorb. And we're only talking cholesterol here, not fat, not saturated fat, cholesterol. There are about 20% of people, most of them because of that loss of function of niemann-pick C1 like 1, who are these hypoabsorbers of cholesterol. But on the other end, there's about 20, 25% of people that are overabsorbers of cholesterol. And guess what? They are the people who are going to correlate with increased cholesterol in the serum and possibly, oftentimes, increased incidence of coronary heart disease, atherosclerosis. So when people ask me, does it matter whether I eat cholesterol or not? I said, I can only answer that question if I knew, are you a hypoabsorber, an average absorber, or a hyperabsorber? If you're a hypoabsorber, eat 42 eggs a day. It doesn't matter. Most of it is not going to get in. But if you even have a little bit of hyperabsorption, that's probably the person we're going to advise. Back off the cholesterol a bit in your diet, and you can play it and see how it affects. So that's the only way to answer that question. You cannot make a general statement, eating cholesterol is bad, because it's going to get in. And some people it will get in, and many people it will not. And some people will never get in. So and very few of us are checking our genetic function of the niemann-pick C1-like protein. But there is a blood test, and I'll get to it in a moment, that could tell me or you as doctors that, oh boy, this is a person who is either over-synthesizing internally cholesterol molecules in their cells, or this is a person who's, for a variety of reasons, is over-absorbing cholesterol. You know, Gil, and you give way better dietary advice than I ever do. Whatever dietary advice you're going to suggest to a patient, you're individualizing it for that given human based on so many things you've found in the history, their nutritional history, their biomarkers that you're checking in the blood. So in most of those, I don't think we have to shove down everybody's throat. You can only eat 200 milligrams of cholesterol a day, because the amount of cholesterol you're eating may have nothing to do with your atherosclerotic. But there are some who would. So you can do it by trial and error. Look, you're not measuring phytosterols or genetic tests for hyperabsorption. They have a high ApoB, LDL cholesterol. You want to give them 2 months of stop eating cholesterol and see what happens. Okay, no harm done. So many doctors will do it that way. I'm just a lipidologist. I notice stuff. I know how to use biomarkers. So you will get a more serious, thorough, comprehensive exam from me. Other clinicians will say, oh my God, what a waste of time and money. You don't need them on everybody. So, and look, I'm the guy who wrote the chapters on this stuff. So I've spent a lifetime studying sterile homeostasis.
Well, that's why we have you on.
All right, the next step. I'm a free cholesterol. Niemann-pick has pulled me in. That intestine is going to say, either we do need some of this cholesterol to get inside, to get internalized, or good God, we don't need any more cholesterol. We have to get rid of the cholesterol that the niemann-pick C1-like protein allowed in. So, as I said, there's several forces at play. The niemann-pick is what we call a cholesterol influx protein. It brings cholesterol from the gut lumen into the enterocyte. There's a parallel receptor that sits very close to it on the cell membrane between the enterocyte and the gut lumen, exact place where the Niemann-pick also sits, but they're different receptors. This receptor is called the ATP binding cassette transporter, G5 or G8. There are two of them. They work together conjointly if they're working properly. And what the purpose of that receptor is, the intestinal cell says, oh my God, we absorb too much cholesterol through the Niemann-pick. We're not going to let it go inside. We're going to evict it right back to the gut lumen. And they turn on the genes that express ATP binding cassette transporters, G5 and G8. So if too many cholesterol molecules pass from gut lumen into the enterocyte, they can be immediately re-evicted right back to the gut lumen, in which case then they will pass through the rest of your intestine and be excreted in the stool. So you can see what is the major regulator of cholesterol absorption is going to be a wonderful joint action of the Niemann-pick C1 pulling it in and the ABC G5, G8 evicting it. If they're working in harmony, we will wind up with the proper amount of cholesterol that our body was hoping would be absorbed. But if we have defects in Niemann-pick C1 like one, or if you have loss of function of ABC G5, G8, you got the wrong genes again, any cholesterol that gets into your enterocyte has little ability to be evicted back to the gut lumen, then it is going to wind up in your body because it's got to go somewhere. So you have this happy interplay of G5 and G8. As a quick little aside, because the body just so tightly regulates cholesterol absorption, the liver was also given a set of G5, G8, and Niemann-pick C1 like one. So if phytosterols ever wind up in your liver because somehow they pass through the intestine, or if you even absorb too much cholesterol, the liver has a defense. You thought you were going to get in. I'm going to evict you through the ABC G5G8 right back to the bile, and you're going right back to the intestine, buddy. It's like a backup door bouncer. You may have gotten through the first bouncer, the G5G8 niemann-pick in the intestine, but the odds are less you're going to get through the liver, because the liver will recognize you as fraudulent and express them. Now, there are a lot of people who don't have total loss of it, but they have partial loss of G5G8. So they're not going to super absorb a few more phytosterols than usual to get in. If we measure that, we know the system is broken, and that's how phytosterols measured in the blood have clinical value. But remember, the ABCG5G8 also evicts extra cholesterol that the intestine doesn't want, or even the liver. If the liver's got too much cholesterol, get out of here. I'm putting you right back in the bile, and I'm sending you down to the intestine again. So if you have partial loss of function of ABCG5 or G8, you are going to be one of those 80% hyperabsorbers of cholesterol, or maybe more. You might be a 95%. If you do have a loss of function of ABCG5G8, you are going to have too much cholesterol in your system, probably have a high ApoB level, and it's very treatable hyperabsorption of cholesterol. So it's crucial for a clinician to know that. If for some reason you did a genetic testing and it indicates partial loss of function of G5G8, the odds are huge you're going to need an ApoB lowering therapy that blocks the absorption of cholesterol. And doctors know, and many patients know, that's a drug called ezetimibe, or originally sold as Zetia.
If people don't have that genetic test result, the poor man's test would be to just measure their blood cholesterol levels or their ApoB or their LDL cholesterol, and then try to eat a few eggs, maybe a couple eggs a day, and then measure again?
Well, yeah, but there's a better way of doing it. There's a blood test that's going to tell us, not a genetic test, which are more expensive, harder to find, but a simple blood test that would tell us, oh my God, you're absorbing too much cholesterol. Almost is always due to loss of function of G5G8, not excess function of niemann-pick C1 like one. Before I tell you about that test, now I've told you how free cholesterol gets in or gets out of the enterocyte, but now the enterocyte has a pool of cholesterol that it finds acceptable, but it knows it has to get it into the body. It either has to be delivered to this tissue or that tissue, or most of it's going to go to the liver, and then the liver can decide what to do with the absorbed cholesterol. So how does cholesterol now get from the cytosol, this inside of the enterocyte, into the liver? Well, it has to be put in something that's going to take it out of the enterocyte, take it through some circulatory pathway, and dump it in the liver. The enterocyte says, all right, give me X glob of cholesterol, give me X glob of triglycerides, I'll make an oil droplet. Now all I have to do is wrap them with a protein, and I've created a lipoprotein. It happens to be one of the ApoB family of lipoproteins. And it's a big one, it's our biggest lipoprotein by far, is produced in the intestine. It is called a chylomicron, which the intestine then just secretes into something called our lymphatic system. It's a different type of circulatory system that connects cells with the blood. So the chylomicrons get poured out of the intestine into the lymphatics. It's a short journey. Our lymphatics enter the bloodstream, up in our neck. So those chylomicrons take a sub-pathway to get to the bloodstream, the lymphatic system. Now, the big purpose of that giant chylomicron carrying energy, triglycerides, is to rapidly rush to muscle cells or adipocytes, the two tissues that express an enzyme that sucks those triglycerides right out. Now, when I take a big chylomicron and I remove a large chunk of its triglycerides, it becomes a much smaller chylomicron that's called a chylomicron remnant. The liver has receptors that recognize chylomicron remnants and pull that now reduced, but still large chylomicron molecule into the liver. And what's on the inside of that chylomicron remnant? That's how the cholesterol goes from your intestine to your liver. It co-shares space with triglycerides. The triglycerides are removed by muscles or fat cells. The remaining shrunken chylomicron or remnant delivers the cholesterol to the liver. Now the liver says, ha, I have a nice supply of intestinally absorbed cholesterol. Now it's up to me to decide what to do with that. The liver will also be synthesizing some cholesterol, and the two pools mix. And then the liver decides what to do with both synthesized and absorbed cholesterol. All right. But let's go right back to the intestine. I told you, all right, step one is to throw the cholesterol, ester, and triglycerides inside a chylomicron. Ship it out. There's still some remaining free cholesterol molecules there that have not been esterified. Pathway to how cholesterol exits the enterocyte is not going into a chylo. Much of it does, but there's a backdoor exit going into an HDL particle. One of the crude signs that a doctor can look at in the bloodstream that at least should suggest I might be dealing with a hyperabsorber of cholesterol is their HDL cholesterol is tending high, because the HDLs are acquiring extra cholesterol molecules at the small intestine. Most of the cholesterol in HDL comes out of your liver, but X amount comes out of the intestine, especially if you're a hyperabsorber. So it's a real poor man's clue that if I see, geez, LDL cholesterol's up, but your HDL cholesterol's up too, at least think of hyperabsorption of cholesterol. You see a man with an HDL cholesterol of 60, that's unusual. 70, God, what's going on here? Maybe you want to check absorption in that man. A lady, it'd be a little bit higher because, as you know, women have slightly higher HDL cholesterols than do men. But it's a poor man's surrogate of hyperabsorption of cholesterol. I've already talked about it, but there is a third way that enterocyte can get rid of unwanted cholesterol. So chylomicrons 1, lipidate HDLs 2, but remember, it could send any unwanted free cholesterol right back out through the ABCG5A, back to the lumen of the intestine, and we can kiss it goodbye.
Hey guys, Dr. Berg here. I want to talk about what you must know if you don't have a gallbladder, okay? People are told they don't need the gallbladder. It's an unnecessary organ and you won't have any problems, but there's some long-term effects. First of all, what is the gallbladder, okay? It's a little sac that hangs underneath your liver about the size of a little potato, and there's a tube that comes from your liver and this little sac that hangs off this tube, all right? But the key is what it holds, what it stores. The gallbladder stores and holds bile, okay? B-I-L-E. What is bile? Bile is the very important fluid that helps you absorb fats, absorb fatty soluble vitamins, regulate cholesterol, help balance hormones. So it does a lot. It helps lubricate the colon. Okay, so we'll talk about all those. But basically, without a gallbladder, you don't have the concentrated effect. Normally, the bile is concentrated by 5 times the amount in that little sac there. So we need that bile to secrete out when you eat fats to be able to pull it in. So without that gallbladder, you're always going to be deficient in bile. Okay? It's just going to trickle down because it's made by the liver, it's going to trickle down. And by the way, bile is what prevents gallstones. So probably the reason why you had a gallstone in the first place is you don't have enough bile. So now when they take the gallbladder out and you don't have the bile, you continue to have other problems. Okay, so let's take a look at, without a gallbladder, all the potential issues. Number one, you're not going to balance the cholesterol anymore. Cholesterol is necessary in the building of hormones, specifically stress hormones, okay? But other hormones too, like testosterone. They're made from cholesterol. Your brain needs cholesterol, the nerves need cholesterol. So also free cholesterol needs bile to help break it down. So you can have more of a buildup of cholesterol without bile. So we have an imbalance of cholesterol, the good and bad. Okay, that's number one. Number two, you may find that you're not actually eliminating toxins. Why? Because all the toxins go through this bile duct when they come and they're eliminated. So the bile helps in the breakdown of toxins and the elimination of toxins. Not to mention the lubrication of the colon, so you may end up with constipation. Okay. Now, the next one is thyroid. T4, the inactive thyroid hormone, is converted to T3 through the liver and the gallbladder. So without a gallbladder, your thyroid can suffer in that it won't convert. So you might end up with a thyroid issue, which affects a whole host of problems because we need that gallbladder to do the conversion. Okay, so the other one is preventing fatty liver, because the fat can actually build up in the liver if you don't have the bile. Bile breaks down fat. Now, if you don't have the fat-soluble vitamins, vitamin A, the vision suffers. You won't be able to see at night when you're driving in the dark. The vision just kind of goes down with vitamin. You need vitamin A in general for your vision, okay? The skin becomes dry. You have issues with skin. The inner skin of the inner sinuses become a problem. Sinus problems, sleep apnea, immune system, that's all vitamin A. Vitamin D is the regulation of calcium. So you may find that your calcium is off, especially the metabolism of calcium. You get bone pain, you have issues with the immune system, things like that. And then also when people are low in vitamin D, they have problems with depression during the wintertime because they don't have enough vitamin D. Vitamin D is also good to prevent asthma as well. Okay, vitamin E, very essential for the heart. Vitamin E increases the oxygen to the heart by 250 times. 250%. So it actually increases oxygen to the heart to prevent heart cramps. It's great as an anti-angina nutrient. Vitamin E is also called the anti-sterility, so it prevents becoming sterile. It helps fertility. Vitamin E is important in the skin. So many women use it on their skin, vitamin E oil. But then we got vitamin K1. That's to prevent bruising and to help clotting. Vitamin K2 prevents the soft tissue calcium from building up in the arteries and the joints. Very, very important. There's even certain phytonutrients like plant-based chemicals in like the cruciferous vegetables that are fat-soluble too. Like we have lycopene, lutein, carotenoids. Those are all fat-soluble. Those are all very, very important in protecting the eye, protecting it against macular degeneration, just helping you see in general. So those are fat-soluble. So, and then also you're not going to absorb the omega-3 fatty acids. Like think about why you need omega-3 fatty acids. That's all anti-inflammatory. I mean, it's precursors to build body tissue, so many issues. So these are just a small list of potential issues that you could have if you don't have a gallbladder, okay? So I hope that gave you some enlightenment. The question is, what do you do if you don't have a gallbladder? Well, what I would recommend is to take some type of bile support to supplement your body so when you eat, you have enough bile to prevent these issues. But you have to realize that it's going to be a slow process. It doesn't happen overnight. So you may see symptoms months after the gallbladder is removed. All right? All right, thanks for watching. I will see you in the next videos.